Hello, everyone. Welcome to the First Nations and Inuit Health webinar on crystal meth, presented by the National Collaborating Center for Indigenous Health and the National Collaborating Center for Infectious Diseases. The National Collaborating Centers help bring knowledge and evidence for use in public health practice and in policy. I would like to begin today by acknowledging that I am in Treaty 1 territory, and this is the traditional lands of the Anishinaabe, the Cree, the Oji-Cree, Dakota, and the Dene people, and the homeland of the Métis Nation. I would also like to acknowledge the mistakes and harms of the past that contribute to the lives of people today. We would also like to acknowledge the people and organizations that have contributed to the planning of this webinar. This includes the Assembly of First Nations, the Thunderbird Partnership Foundation, and the First Nations Inuit Health Branch. My name is Jami Neufeld, and I'm a project manager at the National Collaborating Center for Infectious Diseases. I manage STBBI projects, and I am very honored to be the moderator here today. Our first speaker today is Carol Hopkins. Carol Hopkins is the Executive Director of the Thunderbird Partnership Foundation and is of the Lenape Nation at Moraviantown, Ontario. Carol was appointed as an officer in the Order of Canada in 2018. In 2019, she was recognized with an honorary Doctor of Law degree from Western University. Carol Hopkins has spent more than 20 years in the field of First Nations addictions and mental health. She holds both a Master's of Social Work from the University of Toronto and a PhD equivalent degree in Sacred Indigenous Knowledge. Carol also holds a sessional faculty position in the School of Social Work at King's University College at Western University. Carol has co-chaired national initiatives known for best practice in national policy, review, and development, resulting in the First Nations Mental Wellness Continuum Framework, the Honoring Our Strengths, a renewed framework to address substance use issues among First Nations in Canada, the Indigenous Wellness Framework, and the Best Practice Guidelines for culturally based inhalant abuse treatment. Carol has also inspired the development of the Native Wellness Assessment. In recognition of this work, Carol received the Champions of Mental Health Award in 2015 for Researcher Clinician, the Health Canada Innovations Award, and was a member of the Leadership Advisory Council to the Ontario Minister of Health and Long-Term Care and was part of the Canadian delegation to the 2016 United Nations General Assembly special session on the World Drug Problem. Carol also participates on a National Mental Health Advisory Council to the Federal Minister of Health. Marcia Anderson is Cree Anishinaabe and grew up in the north end of Winnipeg. Her family roots go to the Norway House Cree Nation and Peguis First Nation in Manitoba. She practices both internal medicine and public health as a medical officer of health with the Winnipeg Regional Health Authority. She is the Executive Director of Indigenous Academic Affairs in the Ngāmuzwin Indigenous Institute of Health and Healing at the Rady Faculty of Health Sciences at the University of Manitoba. Her current active areas of work include youth health and Indigenous healthcare quality. She serves as the chair of the Indigenous Health Network of the Association of Faculties of Medicine of Canada. She is a past president of the Indigenous Physicians Association of Canada and past chair of the Pacific Region Indigenous Doctors Congress. She was recognized for her contributions to Indigenous people's health with a National Aboriginal Achievement Award in March of 2011. In 2018, she was named one of the 100 most powerful women in Canada by the Women's Executive Network.